We'll talk about another type of high levels of bilirubin in the body, and this is the chemical type. So you say chemical hyperbilirubinemia. Okay. So of course, when there is high bilirubin, you're having yellow discoloration of the skin and also the sclera of the eye. So for the chemical hyperbilirubinemia, it just refers to elevated bilirubin levels in the body. That's in the blood, right? Okay, and that one is not because of any other issue. That one was caused by you are exposed to some drugs or toxins. So it's the drugs and toxins that actually cause issues to the liver. Do you understand? Thereby affecting how bilirubin is being formed. That is why you are having what? High levels of bilirubin. Do you understand? So the condition arises from chemicals, typically due to drugs you are taking for a particular condition or environmental toxins. So they interfere with the liver's ability to process and excrete bilirubin. So it will now result into the buildup of bilirubin in the bloodstream. So common drugs that can cause such an issue. We have antibiotics like Rifampin, erythromycin. Okay. Have anticonvulsants. Okay. Anesthetics like what? Halothane. Chemotherapy agents. Okay. So toxins like industrial chemicals, herbal supplements, alcohol, all can actually damage the liver cells. Then sometimes contrast agents. So contrast agents that they can actually give you just to do imaging. Some of them, they have to be detoxified by the liver, so they can cause damage to the liver cells. Mechanism of action is the chemicals may actually cause by damaging liver cells. That's hepatocellular injury. They can cause blockage in the flow in the liver. They can affect enzymes. Now, clinical features is normal thing. Normal, the way normal jaundice would be like. So yellowing of the skin and eyes, dark urine and pale stools. They are weak abdominal discomfort, elevated liver enzymes. So diagnosis, we said that there was an exposure of drugs and toxins. So you ask questions in order to identify which drug or which toxin, right? Liver function tests and bilirubin fractions, imagings to see if there's any structural issues. Okay. Treatment is basically just stop the drug or stop being exposed to that toxin. So the treatment is quite simple.